In this video, you will see a demonstration of what to do during a suspected opioid overdose and how to use the Narcan Nasal Spray Kit provided by the San Luis Valley's Nalaxone Empowerment, Education, and Distribution Project. Funding for this project was provided by the San Luis Valley Area Health Education Center and the Health Resources and Services Administration. Narcan Nasal Spray reverses opioid overdose. Opiates include heroin, methadone, OxyContin, Vicodin, Percocet, codeine, fentanyl. Narcan does not reverse overdose from drugs like cocaine, meth, alcohol, or benzodiazepines. How do I recognize an opioid overdose? Decreased or absent breathing, turning pale, blue, gray in lips or fingernails, snoring, gurgling, gasping, or choking sounds, unresponsive to yelling or stimulation. Follow the Save Me steps to respond to opioid overdose. S. Stimulate. A. Airway. V. Ventilate. E. Evaluate. M. Medicate. E. Evaluate again. Stimulate. Yell the person's name, check for breathing, rub sternum with your knuckles, look at their fingernails and lips for a blue-purple coloring.
Kate, are you okay? Kate!
If unresponsive, call 911 and continue with the Save Me steps. Narcan nasal spray is not a substitute for emergency medical care.
Hi, I'm with someone that I think stopped breathing. Please send an ambulance.
If someone is with you, have them call 911 while you perform the Save Me steps.
Hey, go call 911. I think she stopped breathing.
Okay.
Airway. Open the airway by pulling chin upwards and open the mouth. Check that the airway is not obstructed by anything. Ventilate. With the chin pulled back and the mouth open, pinch the nose and give one breath every 5 seconds.
One, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Evaluate. Look to see the rate at which the person is breathing. Are they breathing normally? Are they breathing on their own? Medicate. If the person is not breathing or is breathing very little, give the nasal spray. If in doubt, give Narcan nasal spray. Respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to administer Narcan nasal spray. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle finger on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste some or all of the medication. Gently insert the tip of the nozzle inside the nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. Evaluate. Narcan nasal spray takes 3 to 5 minutes to work. Continue rescue breathing until emergency medical services arrive or the person comes around.
One, 2, 3, 4, 5.
If you are unwilling or unable to stay with that person, you must call 911 and place the person in the recovery position. To place in recovery position, roll them onto their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. If the person is dependent on heroin or other opioids, they may go into withdrawal after you give them Narcan nasal spray. Withdrawal symptoms can include vomiting, diarrhea, sweating, and agitated behavior. This may be unpleasant and dramatic, but it is not life-threatening and only lasts until the Narcan wears off. If or when the person becomes alert, it is important to tell them that the Narcan wears off in 30 to 45 minutes, and there are still drugs in their system. Within 90 minutes, the withdrawal effects will be gone. Stay with the person until EMS arrives. They may go back into overdose. Do not let them use more heroin or other opioids. The Narcan will block it, and they could overdose again once the Narcan wears off. In review: stimulate, sternal rub, check for breathing, call 911. Airway: tilt chin upwards and check airway for objects. Ventilate: perform rescue breathing, 1 breath every 5 seconds. Evaluate: check rate of breathing. Medicate: administer Narcan nasal spray and continue rescue breathing. Evaluate again. Continue rescue breathing until the person becomes alert or the emergency medical services arrive.
Hey, are you okay? Kate! Kate! Hi, I'm with someone that stopped breathing. Please send an ambulance. One, two, three, 4, 5. 1, 2, 3, 4, 5. One, 2, 3, 4, 5. 1, 2, 3, 4, 5.
If you are unwilling or unable to stay with that person, you must call 911 and place the person in the recovery position.